Phacofracture, a way to innovation from 6 mm to 2.8 mm incision in manual SICS. I'll be showing multiple small videos whereby the emphasis is on the size of the incision and how to fracture the nucleus. The first one is 6 mm, which is conventional, and this is how you do it by doing a phaco sandwich, and you implant the IOL right in the bag. This is 5.5 millimeters. This is I have shown how to bisect the nucleus using Sics and wire vectors. Copious amount of visco so that there is no endothelial damage. Now the other piece can be taken out either by visco or either by sandwich or by wire vectors alone. We have further reduced the incision to 5 millimeters. So here I have shown how to trisect the nucleus. As soon as you trisect, when you take out the wire vectors, the middle piece automatically it comes out. Now here, this is one piece, this is the other one. When you take out the wire vectors, the center piece comes out. Now I always divide 2/3 and 1/3. I'll explain you later why I do so. Now this smaller piece, this can be taken out by hydro expression, and the bigger one we can go for visco expression. So you see, in particular case, we do multiple procedures to get good results. So in this case, we have done visco expression, we have done hydro expression, and trisection. We have further reduced the incision to 3.5 millimeters. There is a bit of modification in this. After doing capsulorhexis, we bring the nucleus right into the anterior chamber. We divide the nucleus 2/3, 1/3 and bring both the pieces at the tunnel. So there is a breakage at the tunnel side. The remaining pieces, they are 1.5, and slowly all the pieces can be taken out either by sandwich or by wire vectors alone. Since the size is 3.5, so we have to use an injector in this case. You can see the rhexis margin, and you can dial the nucleus into the bag. Now here there is an innovation with 2.8 millimeter incision. Now look at the incision is so small. We'll be doing combination of procedures in this eye. Since the incision is too small, this is 2.8. The internal lip is slightly opened, about 0.25 on both the sides. Rest of the procedure remains the same. Do the capsulorhexis, do the hydrodissection, bring the nucleus right into the anterior chamber, and now we divide into 2/3 and 1/3. Now the bigger portion, we again put wire vectors and Sics and divide this bigger piece into 2, bring both the pieces at the tunnel side, and there is a fracture at the tunnel. Now remaining which is inside is only 3 small pieces. Last piece, sandwich technique, slowly take out. Now you can see cornea is comparatively clearer, except there is little bit of edema which is at the wound side and little bit at the side port. So just inject the IOL right in the bag. Now this is the innovation measuring gauge which I have made it, stainless steel. The lower mark which you see is of 2 millimeters, and it's at the gradation of 2, 4, 2.5, 2.6, and then 2.8. The last mark, bigger mark, which you see is of 3 millimeters. So this gauge is not going inside. This confirms that the size of the incision is 2.8. These are first post-op cases. You can see the cornea is comparatively clearer, and This is 2.8 millimeter incision, 10th day. Absolutely clear. You hardly see any mark. Within 20 days, the whole thing disappears. The astigmatism is around 0.5 diopters. Thank you.